Dr. Schwartz, what can you tell me about your clinical background and expertise?
I'm an adult psychiatrist. I'm an associate professor at SUNY Upstate Medical University. There I do a bunch of teaching, a little bit of research, some administration, so I do a lot of things to keep me busy.
Tell me about your role as editorialist for 2 papers in the September issue of CNS Spectrums Journal.
Yeah, I think that was interesting for me. It was my first time in that role, and I got a chance to critically review some papers, make some teaching comments, and really write my opinion. So it was a lot of fun to do.
Can you tell me about your role as editor handling conflict of interest for authors and editors of CNS Spectrums Journal?
So that's an interesting role too. It's not necessarily my job to look at statistics and the scientific rigors of the paper. That's for the other editorial staff. I get to comb through the paper, look to see if the claims it makes are reasonable, see if it's supported by the data, make sure there's no conflicts of interest like with companies or individuals. So it's a different kind of review.
What does CNS Spectrums Journal offer that other journals do not offer?
Well, I think it's an interesting journal. There certainly is data in science and numbers and statistics. It does have articles that are similar to other journals. It also adds a medical education component, and I think that allows us to take the data, take those numbers, translate it into clinical practice. So I think this journal gives you both parts of that information.
Specifically for the practicing clinician, what does CNS Spectrums offer?
I think its educational value is very good. I think you can read it, you can read the papers, you can take home the data, but I do think you can turn around and apply that information in your practice. So I think it's a nice 1-2 punch, so to speak. You have the data, you get some clinical teaching, and you can go in and use this when you see patients.